Tonight, we talk to a global social innovator making great strides in fighting a disease that is killing millions. Pradeep Kakkattil founded a platform that connects innovators, governments, and investors to develop healthcare solutions for many AIDS and many other illnesses. His work was recently recognized at the World Economic Forum. Pradeep joins us now live from Geneva, Switzerland. Pradeep, congratulations on the recognition.
Thank you very much, Rico.
So you've spent a lot of time fighting the spread of AIDS. Tell us, has this fight taken a step back due to this COVID-19 battle?
Thanks. I've spent about 30 years addressing the AIDS issue. And what we have seen is that we have made significant progress over the years. But also now, COVID has really made it a little bit more difficult. What we are seeing is that the access to prevention services for young people has fallen by nearly a quarter. Similarly, treatment, we are finding challenges in some countries where people are finding it difficult to find the antiretrovirals because of supply chain issues. But I do believe we have made progress. COVID is stopping us, at least reducing the speed of our progress. But I do believe that I'm optimistic about the future.
Where are we at right now, Pradeep, in ending AIDS as a public health threat?
I think we are still a long way, but the optimistic part is that we have all the technology needed, all the resources needed to end AIDS. So we have antiretrovirals, which prevent people from, people can live almost normal life. We have all the prevention tools. I think where we are lacking is the distraction that has come both at the political level, but also in terms of programmatic challenges, because the health system is challenged. There are so many things that COVID certainly has taken away a lot of attention on the health system. And that, for the future, is a big issue, because when we emerge out of the COVID pandemic, we're going to have a health system which is nearly burned out. So how do we make sure that we continue to deliver the services, not just for HIV, but across the health sector?
The fight continues. You have been recognized for your Health Innovation Exchange, which is a global platform that helps connect innovators, governments, and investors to develop healthcare innovations. Where have you found solutions for healthcare problems outside of AIDS?
A lot of the work that we are seeing is that there are so many solutions out there, but the people who need to adopt that and implement it, they are often the last ones to hear about it. So, for example, we speak about COVID, and one of the things that I would like to quickly talk about is BioVite, for example. It's a LED bulb which provides a particular spectrum of light. It's a regular bulb that you see everywhere, but it provides a particular spectrum of light. What we discovered was that this particular bandwidth of light, it kills bacteria, it kills fungus, it kills virus, including the coronavirus. So what we do as part of the Health Innovation Exchange is that we work with countries to find what their challenges are, and then we find solutions like this. I could give you a couple of examples if that's useful. One is this, which the advantage of something like this is that in public places, where do we get infected? A lot of it is because we are touching surfaces where there is a deposit of the virus, or in the air. So this kills both at the surface level as well as in the air. So that's one, but happy to give you a few other examples.
Well, a lot of innovations, particularly in the health sector. Let me try to bring some of that health context to the Philippines. Pradeep, the Philippine presidential elections will be taking place this coming May, so all eyes will be on the candidates and their promises to combat COVID-19 and other health issues. In your view, what should leaders do when it comes to keeping their citizens healthy and safe?
That's a great question, and maybe three things that I would say is really critical where leadership counts. One, invest in health, because we have seen with COVID what not investing in resilient health systems means for the economy, for people's jobs. and for the future. So, one, invest. Number two, make sure that we are willing to adopt innovations because what we did, most of our health systems were developed 30, 40, 50 years ago. But the world has changed so much. If I were to take a banking analogy, I don't think, I guess most of us probably use electronic banking much more than we would, but the health system has not caught up. So we need to modernize health systems. We need to use technology and innovation
Right.
and the appropriate ones. I'm not saying just blindly follow it. Three is empower people. I really believe that you cannot take the decision and the ownership of a decision away from people. So if we can really engage and treat people, individuals, the citizens as responsible adults, that would be a huge leadership agenda.
And how involved should our leaders be in crafting healthcare policies, or should they just leave it to advisors?
Leadership is about engaging everybody. It should not be a bunch of people sitting in a room or sitting somewhere else deciding what needs to happen. You need to engage. And when I say leaders, it's not just someone at the top, but you need to engage at all levels because we have seen that unless communities are involved, unless faith-based organizations are involved, unless you really engage, health is something which is not, it cannot be mandated from outside. It cannot be something that can be thrust down people's throats. So you need to have the leaders have a conversation that brings the different perspectives and lived experience. And then that will ensure that we have healthcare which delivers for people, which ensures that nobody is left behind.
Thank you so much for your insights. Pradeep Kakkattil, Director of Innovations for UNAIDS.